my mind goes to that I think would be interesting to hear your perspective. What should the outcome of integrated care be? And I think about this a lot of times, and we got some cool data, and we've loved showing our data from Community Health in Central Washington. We love promoting it. The one thing I often struggle with is that oftentimes, especially the patient-related outcome data, is geared to the patients that we have seen versus patients that we haven't seen. And while that's cool and that makes me feel good, like I always think, and we talk a lot about this with Jeff, is this idea of like, is that the outcome that I want? I want care to be better for everybody, not just the people that I see, right? So I'm interested in what your perspective is on this. Like, what's the outcome that people should be looking for with integrated care?
Yeah, I mean, that's a nut I've tried to crack throughout my career. The one thing I can say that the outcome is not necessarily like symptom reduction.
Okay.
Just too narrow a focus, and frankly, it places too much of an emphasis on a particular human experience. Right? So it's the idea, and this is where, again, I've been heavily influenced, as you have, by ACT, right? This idea that a symptom-free life is the best life. And for many of us who work in underserved communities, or who have worked in underserved communities, we realize that a symptom-free life would be insane.
It wouldn't be normal. Contexts. It would be weird.
Yeah. So why choose that as a metric?
Right.
And then the more I've lived and breathed primary care, the more I've really understood that my role in primary care, and in fact, I think probably our legacy as folks in integrated care in general and PCBH specifically, our legacy is going to be the teams and the team cultures that we leave behind. To me, that's the most transformative piece, because at every clinic I've been at, what the feedback has been most impactful from administration, from fellow providers, behavioral health and medical, from front desk staff, from nurses, from medical assistants, has been this sense of gratefulness that somehow something has changed about the way the team operates by virtue of what we have done. That, to me, if you think about the legacy, it's not about necessarily how many patients I saw or how many patients our team saw. It's how we changed the community of care that saw those patients. And I don't know how to capture that other than to really say, I think for me, my metrics ought to be the physician's metrics. The physician's metrics ought to be my metrics. The team's metrics ought to be our metrics. We're here to care for whole individuals. And so, yeah, that means I care as much about diabetes metrics, and I care as much about hypertension metrics as I might care about patient satisfaction and how well we're doing with getting to see patients on time and having accessibility for visits, et cetera. All of that is what I feel like is what I'm doing as a part of that team. So, yeah, less and less, I don't see the specific behavioral health metrics, and I love your numbers, don't get me wrong. I love this stuff, and I wish more people would actually post the kind of numbers you guys are posting and the way you guys are posting it. But the mental health specific stuff only captures a really small slice of what actually integrated care is about. And I don't know how to capture the other stuff other than to say that whatever metric that primary care is judged on, or to be more specific, whatever metric that particular primary care clinic would be measured by, that's the measure I want to be measured by, because I'm pulling that same, rope along with my fellow teammates. So it doesn't really make a whole lot of sense to me to just look at, very narrow scores on a particular thing. That can be helpful for like QI processes and figuring stuff out where things are not going well in particular areas, flow processes, et cetera. But as a larger validation, honestly, like my perspective is what we're doing with PCBH is we are filling a void in the care system. Which is why almost everything you do when you compare research-wise to usual care is going to be better, But I don't use that to validate who we are in integrated care, because that's not the standard. The standard is not, can I do better than usual care?
Correct.
No, to me, it's like a duh experience. We should have had behavioral health alongside medicine the whole time.
Right.
We just didn't. And that's why we have a lot of the problems we have right now as far as how we care inefficiently for patients. So that's what we're doing. We're just fixing what should have been there the whole time.
I agree. And I think my mind goes, and I was talking to a colleague of mine, one of my mentors who's more in especially mental health world. And he was asking, what do you think the outcome measure should be in what you do? And as you said, like, I think without question, it should be the clinic specific outcomes in what we do. And I think that's a shift from really what we look at integrated behavioral health about being. I think a lot of times you say that to people like, well, why would I care about, these other scores? Like, because that's what, as you said, we should have been caring about those things all along. I do think, and I don't know how you measure it. I think you could measure it in a couple of different ways, but I think patient engagement, I think is a one thing that I wish we had more data on and to see if we're helping, because one of our interns who now is a fellow, Will Summers, he had a really brilliant thing about, and he didn't come up with it, this is a term that's been around for a while, but this idea of like reverse engineering. And this idea that, what if we asked ourselves, like, how do we want patients to feel once they leave this exam room right now? And then what would we do different? And in medicine and also in psychology, right, we have really good interventions that work when people do them. We know these things will work. The problem is no one does them, or no one comes back to check in about how those things are doing. So my mind always goes to this idea of like, how do we keep people engaged? Because there's a lot of unfortunate things about our healthcare system, but the one thing that is very unfortunate, we don't focus on keeping people engaged with us. And every single time I think about what causes patients to come into a clinic, it's either when they're sick or they have a follow-up and they're going to be told all the things that they're doing wrong and that they're not healthy. Like, why would that person be engaged? And we know the information about like treatment adherence, like, are people honest and are people are genuine with things? And we know that people aren't, and that's due to what we're doing, not due to them. I just think this idea of patient engagement could be really, that again, how do you operationalize that? I don't know. But yeah.
I think you're really right on point with that, because I think what you're pointing out is that engaging a patient really encompasses the work of the entire team, the entire
Correct.
clinic, right? From the front desk staff all the way back, right? And so that's what I'm saying. So the catalyst of behavioral health often is, not always, because there's sometimes when you can have behavioral health in a clinic, it's so isolated, so co-located that it's its own little thing. But if you're really doing really good PCBH, you are actually impacting the way registration thinks and works and acts, medical assistants, nurses, et cetera. And again, this is lived experience on my part where, those nurses who are taking the triage calls, they get better at handling the suicidal patient, the patient in crisis, the patient that's angry, right? Because of their interaction with you, because of the way in which you model that behavior, you might share some of those skills. You might even do a little bit of an in-service every once in a while. You influence their ability to understand the patient differently. And what result is that going to have? Sure, you're going to have a more engaged patient, right? You're going to have a patient who wants to come in, patient who feels respected, valued, included, patient who has providers that have some motivational interviewing training and have an understanding of like, hey, let's start with where the patient is, right? So absolutely, I think some way of measuring how engaged the patients are in their care is important. The tricky part from a research standpoint that I've always run into is that every patient population is very, very unique. And in fact, within a clinic, you'll have different populations. So there are some parts of the population that frankly don't need to be that engaged. So if you're going to measure engagement, for example, in visits, right? So you have some part of the population, they're just a healthy, low needs part of your population, and they're going to have low visits, and it doesn't look like they're very engaged, right? And then you're going to have some high needs folks. So you have to, I think we're going to have to just be better at telling the story from a data standpoint and stratify our populations more sophisticatedly in order to then match up with what exactly engagement looks like in each of those populations. Same thing I would say with physicians. I think of patient engagement. I also think of physician and medical provider engagement in general. You know, I think it's okay for providers to actually have different sort of habits with how they interact with us as BHCs. You know, you'll always have the high referring providers that are like referring lots of people, and you'll always have those folks that are just on the low end. You want to have some sort of floor there. That's a good floor where the clinic culture is influencing how people refer. But there's going to be variation there, in large part because of the skill of the individual. Some providers like to do a lot of their own behavioral health stuff. That's awesome. That's great. Maybe they only include us in certain kinds of situations. It all goes to the kind of a fundamental of the model that I always go back to, which is cross-pollination, right? We're trying to have overlapping sets of responsibilities as teammates. Some of our teammates are going to be better at what we do, or more better at what we do than some of their colleagues. And that's okay. It creates that variation in the data that we see. So I think the challenge is more of a data mining type challenge and a research design challenge of how do we capture that variation in a way that tells an authentic story about how we're really impacting teams. And then to your point, how patients are responding to that, that team culture.